Good evening, everyone. Hopefully you can hear me and see the presentation okay. And thank you for joining this virtual event in a slightly unusual time. Thank you for the kind introduction. I'm proud to be able to talk today about the work we're doing in BT. But as you will see, I have a background from my previous experience at BT and TfL of how we have managed both very major incidents and industry defining events and their responses, but also a number of global pandemics that have impacted on the world over the last decade or so. And that was one of the fundamental sort of positions that we started from as we responded to COVID. And the role of chief medical officers, they are a rare breed, if you like, and many organizations have them where there is very specific hazards and risk to continuing that operation as an industry, or where there's a critical outcome or impact of a health, safety or well-being hazard. And particularly in aviation and into transport, that's very heavily safety critical. But as leading the national infrastructure as BT does with telecommunications, both in the UK and a number of key markets globally, my role is really to help interpret the emerging risks to the business, identify those controls and measures to help mitigate those, and also with a real detailed and deep understanding of both the business challenges and all of the key individuals that deliver and oversee those business challenges. Some people often say we're here to help the business do the right thing at the right time, and I think no more than now have we demonstrated that. Before we sort of delve into that, I thought it'd be useful just to touch on what a pandemic is. European Centre for Disease Control do have a definition of what pandemics are and what phases of those pandemics we go into, and more importantly, as we recover and respond back into a new normal. And this was essentially the source document that we've been working on since the very first week in January. Many of you on the lecture will have understood COVID from February and into March as we started to see spread both out of Asia Pacific but into the European Union, and also as it started to enter into the UK. We very much used this in the company to start to understand what were the measures that the global health authorities and the likely regional responses we would start to see in those markets. And I'm not going to go through each of the phases, but the critical part here is the hover between phase 4 to phase 6 was essentially the on notice that we had as a global community. This virus had been controlled to a degree in China and Wuhan, but as it started to spread and spread within those countries, we could see that things were changing. And essentially, we've had many years to prepare for this. We've had a number of infectious disease outbreaks over the last 100 years. One of the most prominent that's becoming very referenced during COVID is the Spanish flu. The middle picture talks about the outbreak of swine flu and SARS. So again, we started to understand some of the transmission in high density populations, but also in a very mobile community. And then we touch on Ebola, which isn't a virus that is transmitted through respiratory contact. But what Ebola taught us was a number of things. The rapid containment measures that you need to take, the rapid response from the international community, but also through Ebola, that it wasn't spreading in the way that a normal disease would spread, such as SARS or pandemic flu. It was around the behaviours in communities, behaviours of the actual way of living that caused the transmission, but also the behaviours around health seeking and the perception around how the disease works. So we did a number of different scenarios. Spanish flu, because I think that 101 years ago, pretty much to the month, gave us pretty good idea of what was coming. And you look at the headline on the right from the Seattle Daily Times: assemblies cancelled due to the epidemic at this very moment in time under our second lockdown. And what was very interesting here was being able to understand the impact and the effects and the speed of the effects of social distancing measures. So 100 years ago, and reanalyzed in 2007, we learned that these non-pharmaceutical controls, or social distancing, closing schools, closing shops, and avoiding travel by not by trolley, which is what was happening 102 years ago, fundamental measure of success. When you look at the difference between Philadelphia and St. Louis, you're looking at an 8 to 10-fold difference in peak case rates. So it was an absolutely fascinating analogy to start with. And this takes us on to, what had we prepared for and what had we not prepared for? And it's all very, if you can read this paper, I actually kept this magazine because my time in BA, we were very immersed in Ebola. And one of the few flights I'd done after Ebola, this magazine was on board, and I kept it, and I found it as I was doing the lockdown tidying out that we all did. And it was absolutely fascinating because some of the key measures that we needed to be prepared for was trying to understand what the virus is and what it does, and also what controls we have in place to control and contain it. And that is around globally restricting movement. It was around measurements, and it was also around, in the Time article, suitable supplies of either protective equipment or in co-infection, such as antibiotics and supportive care. And we have planned for those scenarios in the UK as well. But what was perhaps not so clear, as Barack Obama and the Time magazine article looked at, was how do we coordinate that in a global effort? Because globally now we are behaving as the US would have with individual states all those years ago. So that was very much how we started. What was the data telling us? So we knew that this was very quickly, we knew it was a novel coronavirus. So we knew it was going to behave like a flu, like a SARS, like a MERS. So we knew that this type of virus would transmit from close contact from infected people. And close contact from infected people is often how I would be communicating and discussing the risk with employees, members of the senior leadership team, the board, and our business continuity team. So something we were able to do in this increased globalized world, we weren't in 1918 where the data was maybe hard to get. We were able to map what was the impact on our employees and how many people would not be able to come to work. So this was the very early stages. We were looking at this in March, and we were able to see at that point a very steep rise in China and then a very steep deceleration. And if you look at that curve, it looks very similar to some of those curves that we saw in the 1918 pandemic. So we were able to then model that and determine what did that look like in terms of our operational requirements. So we were assuming an absence increase of 1% onto our people. So we established that it was highly infectious and it was likely to cause people to not be at work. This was before the full regime of self-isolation was fully understood. It was then important, how is it going to affect people from a severe level of harm? So we know that this level of the the data from the European Centre for Disease Control showed that those at most at risk were folk with cardiac disorders, chronic lung disease but not asthma, diabetes, were standing out to be 2-3 times as high. So we knew the people who we needed to protect from frontline operations. And these have remained true throughout the whole of the pandemic. So that allowed me to be able to discuss with the operational areas who doesn't need to come to work. And then there was the slightly more worrying question, who's going to end up in hospital and who's potentially not going to make it? So what we could see was that over 30% of those being admitted to hospital were over working age. They were in 60s and above. So our interpretation as chief medical officers in an organisation is the people on the left side of that curve are pretty much all right. And we were starting to learn more by April as we started to go through controls with Italy and seeing who was coming through the other side of that. This is very different to what governments would be looking at, NHS planning, Nightingale hospitals. They're planning for the people on the right side to be admitted. My workforce sit on the left side on the whole. 99.5% sit under the 65. So we're able to reassure this is probably going to cause some absence. There's a certain proportion of people we need to protect, and most people will get through this. So that helps us manage how the organisation approaches this. The second piece is, how are the government going to approach it? So by this point, we had a number of countries that had closed their borders. The US had closed borders to China. We know from our time in Ebola and Zika that countries implement border controls and entry restrictions with little or no notice. So planning for that international lockdown was already in our contingent planning in March, but we needed to understand, well, what's happening in the UK? What can we learn from comparable countries? Because we cannot perhaps extrapolate or respond in the way that China and Asia Pacific have. So we were able to look at Italy. And we were tracking Italy from the start of March, and we understood by this point, as we started to track, that we were about 13 days behind. And the Italy government and the ECDC were warning countries, be prepared. You can see there was a lockdown on the 8th of March. We were not yet in lockdown. And you can start to see, if you move those curves back onto each other, this is our forecasting, that we were anticipating a equivalent lockdown by the 23rd of March. Now, we weren't a million miles away from that, and this was not based on any intel, but we had been telling the business, plan for changes to the way we work, probably into March. And that allowed the business to start to plan. And on top of that, how did we then interpret the key markets? And that's the World Health Organization, the UK government, and at that point published research. That this graph then became the seminal paper that resulted in the rapid containment lockdown 1. But what we understood by the statements from the Director General was we needed to increase testing. We needed to ensure that we had appropriate healthcare systems in place to isolate people, and also that we had all devolved governments all approaching this at the same time. Now, what we were anticipating is that this may control the lockdown, control the spread with one contained lockdown, and that will help schools and businesses to open, close. But we were very much prepared in March for a nationwide lockdown that would potentially result in a huge number of our employees not being able to work from the office, but also on the other side of that, a huge number of employees who would still be required to continue to work and deal with our frontline infrastructure support. We were already planning that the high chance of a lockdown was coming at the start of March. And this paper was then published, and the rest is history. And you'll remember the night that Boris Johnson came on with Prof Whitty and we entered lockdown. So our key recommendations to the business at that point were the safety, welfare and well-being of our colleagues comes first. We need to ensure that we are asking them to work and be in an environment that is safe. We didn't have any guidance from the Public Health England or the government-based guidance at that point on what a secure workplace was, but we understood social distancing was critical. 2 meters to 1 meter, depending which country we were operating in. But there was a lot of information going around that was causing a lot of fear. And again, during our time in Ebola and Zika and SARS, if you lose the hearts and minds of employees, they will not want to come to work. They will be scared at work. And giving clear and regular communication was absolutely critical, and that is first and foremost. And I always remember a cabin manager in BA as I was talking about Ebola, and that it was transmitting through the traditional funerals, and people were catching it in villages, and they weren't really mixing in the towns. And she said, "I'll stop. I just want to know what this means for me." And that stuck with me with every pandemic, and it's also, I think, what the UK population want to hear. What does this mean for me? What do I need to do to be safe? What are you going to do to make me safe? And I'll come on to why that was so critical later on. But what we also had to anticipate is the unknown of whether people would be off work, not because of illness, but because of all the other issues, because we didn't have enough equipment to be able to service the work that they do. Supply chain shortages. As aircraft are suspended from flying with passengers, the cargo that sits underneath them is also suspended. What do we determine as critical business tasks? But most importantly, and our board really stood behind this, a number of people will be looking after people that are ill or children that cannot go to school. And those people will be unable to present themselves to work. And in the role of a chief medical officer is to help people understand all of the other scenarios that will come out of an infectious disease pandemic, that we can interpret the data from the WHO modelling, we can interpret the planning from the Department of Health and Public Health England, and we can probably anticipate from pandemics of a less severity what measures will be introduced. And first and foremost of that is, how do we manage our frontline colleagues who may have to continue to work to maintain the network, because we knew that the internet would be important. We were all going to have to use it. The government have to send messaging across it. And also those core services that we offer, such as our 999 service, our important work at Adastral Park. It was also critically important that we started working with central government and the devolved administrations to help understand how we could help shape some of that guidance, the base guidance of safe workplaces, and also the kind of measures that would be practical, reasonable, and achievable in a workplace. And also the aspects that maybe aren't always considered, training people to do specific measures, putting on and taking off of protective equipment, but also different ways of working. Would that increase risk in the type of work that they do? But most importantly was around people struggling with the ongoing measures that they were being asked to take. And we saw that between the first lockdown and the second lockdown, people were just so fatigued and struggling to keep going and keep doing all of these measures. And that was one of, I think, the key things that we learned and that we really embedded into the business at a really early stage. And I'll touch on some of those in a few minutes. But as a company, I believe we really responded with a real sense of pride, with both the support to our colleagues, but also to our country. You know, we had a number of customers that relied on us to keep going. We were able to work at pace to connect the Nightingale hospitals. But as COVID hit, and one of the lesser outfalls of that was people not being able to see relatives who were extremely unwell and sadly unlikely to make it. And something I'm really proud of was how the team were able to set up a project called Lifeline that rolled out 1,300 tablets to isolating patients who are in ICU. And that human touch and being able to touch people at that individual level was incredibly humbling, but also gave a huge sense of purpose and pride, not just to the team working on it, but to the company. And that's a really important protective measure. We're also able to pivot and transform the way that healthcare was delivered. We were able to really harness the power of the 5G network, using digital equipment and really high quality video links that patients could not only access healthcare through specialist consultations, but most importantly, and you've seen on TV, we had radiologists able to stand in the living rooms looking at scan results. And that was critically important to try and reduce the number of people who did not need to be in hospital. And to celebrate the hard work the NHS were doing, it was great to be able to provide unlimited data to those customers on our network. And our network was one of the key important things that we had to protect. That was our crown jewel of and our top priority as an organisation. We knew that the demands on the network and data were going to be incredibly high, and with a variance that we could anticipate and plan for, but we wouldn't fully understand. And we also had to service a number of people who had to start working with reliable broadband products who hadn't done that before. And our OpenReach team were, doing a huge effort to keep working and working safely. And as you can see on this, our surge demand was anticipated and managed. We would notice that there would be a dip in productivity as people would watch those early national announcements, but we knew there would then be a post lockdown announcement surge. But one thing that I think the team were really tuned into was Call of Duty. So if you know that game, I'm not a player, but it's an online game that relies on connecting with other players around the world. Many people were under lockdown, so when they updated and upgraded that program, the surge demand we were going to have in our network could have had significant impacts on the speeds, and the team worked incredibly hard to ensure that the demand was not only increased but met. And as you can see, during the day we had broader demand throughout the whole day because people were working from home and awake, and really that work-life balance changed. And this was another way that we, as the Chief Medical Officer Office, we're able to understand, well, how are people working? What are people doing? And reassuringly, it's good to see people are indoors on broadband and not outdoors on mobile network. It was great. And something I'm particularly proud on, we recognise that a number of organisations don't have the expertise of me and my team. We were able to pull together some of the real challenges that people were going to face under lockdown, not just from a mental health aspect, but from a deconditioning aspect and from a very worrying financial place. Many businesses did not know how long the lockdown was going to be. They didn't know what the outcome of the other side would be. Would it be effective? So to be able to give small businesses a toolkit that they were able to look at the key risks and how to highlight and signpost those, as well as the financial bursary and mentoring that we had, and a more generous approach with our suppliers. I think the support to the small and medium enterprise groups were second to none in the business. So how did we support our colleagues in the business during this time? First and foremost was communicate back to the cabin manager from BA and back to my station gate line staff at Westminster Station. They want to know, what is this? How do I get it? How do I stop myself getting it? And what are you going to do to make me safe? And it was about clear, consistent messaging. It was clear messaging when governance and government announcements came out. It was also targeted messaging when we understood that there was perhaps a national or a organizational misunderstanding. And it was regular communications from the leadership down, from my office, giving really clear explanations of why something was being done or not done. One of the key parts was protecting the physical, mental health and safety, both of our employees, our loved ones and our customers. So in that immediate state, it was trying to develop what would guidance be. We know that you catch the virus from close contact of someone that's infected, taking infected people away from the workplace, making sure customers weren't infected that we visited, making sure that we were using the expert teams in the NHS, in the prison services and high-risk areas that we had to work in to connect all of those people in hospitals. Making sure that we had a very clear system of work that did not allow engineers and customers to be close, and moving people in contact centres both to home working, but for those who couldn't homework or needed to work in centres, that we had the highest levels of cleaning. In the short term, the lockdown became a new normal. We were under this for many weeks and months. Connectedness, loneliness, and identifying people that were vulnerable who wouldn't have thought themselves vulnerable before was absolutely front and centre of my team's mind. Making sure that we had signposting to preventative mental and physical health services, and making sure that we kept dialogue and discussion about what we were doing as a company and how we were supporting people. And our chief executive made a strong commitment to say no one will be furloughed in the first 3 months. And then we're now in the long term. What does deconfinement and a return to work look like? We're not there yet, but what we can start to say is COVID secure workplaces are in place. They work. We do not have cases that are transmitted from COVID secure workplaces. But we also understand that in the long term, we need to keep reminding people what to do, what's important, and that those basic wash your hands, stay apart from each other, and don't go outdoors if you're sick or exposed to people, remain front and centre. And all of that underpins the support we have to ensuring that we can run our networks. I'm just going to end on a couple of thoughts about how COVID is impacting on workplace wellbeing and what we're likely to see in the coming weeks and months. What we learned very quickly was that, and you'll remember this from your perhaps your own experiences, in the first lockdown and the lead up to it, people were queuing, stockpiling, toilet roll, food, it was back to our Maslow hierarchy of needs. Our people were back to what I was saying earlier. How can I get it? How can I stop getting it? And how can I be safe? That was a regression back to our safe, basic needs as our fundamental needs. And the critical part here was, it's not that these were never asked for before, but they became front and center of everything that our people were looking for. 60% of our people wanted clean, safe workplaces. 42% wanted really clear guidance. And they also wanted those support for those people that are vulnerable. And this pulls together, I think, a real demonstration in lockdown 1.0. Meeting basic and psychological needs will allow a company to be supported and thrive. And our 5 pillars, our 5 areas of wellbeing that underpins our wellbeing strategy in BT really drove that out. This gave us a really clear roadmap on how to work. Pretty much within a week, we moved from some of the health matters to environment, relationships, underpinned and ignited by purpose. You can see the amazing work that the company did, but that relationship and that environment and security was front and center. A safe workplace, safe ways of working, safe protective equipment, and safe communications, and also an environment that they felt safe coming to and working in where they were asked to do so. And that goes for home as well. We moved a huge number of people home across the world, and in India, home working is not a cultural norm. So we had to set up not only how to support and guide those individuals into working from home, but also balancing work-life balance and giving them the right amount of DSE kit that we take for granted here in the UK. What we've learned is belonging to the company, workplace connectedness, and the role of the line manager are absolutely critical here. We've got a huge number of shocks yet to face, and a number of our colleagues on low incomes may become sole wage earners in the short and medium term. People are also struggling with, when will this end? You know, is it going to be Christmas? Is it going to be next year? And it's helping support key messages, but also giving people the space and the resources to talk about how they're feeling. And that's making mental health much more personal. And one of the key lessons that we have learned from the pandemic that I don't want to lose, that we're all talking about health, safety, well-being, and welfare, and investing in those has really stood us out. And this is a great slide that Peter Kelly from the Health and Safety Executive I often refer to when we're talking about how the pandemic's impacted. And this is a study from the US of military personnel, and it was always uncertain why at the end of a mission are people really starting to unravel. We've got that initial stage of, we know what we need to do, we know how to protect ourselves, and we know what we need to do to get through this. We then get into a period of adaptation, and during lockdown 1 and the short period after, eat out to help out, etc., we kind of adapted to that. We coped not being able to go on holiday. We coped not being able to stay overnight in friends' houses. But now as we hit the next wave, people's mental health and their ability to cope with this is struggling. And this model, for me, really sums up where we are. The end of a new challenge, I believe, is where we are, and we're starting to see the yellow zone of stress starting to really magnitude. And this really leads into my final slide, which is what are the emerging challenges we're going to face over the coming 12 to 18 months. This was a 2-year period. It is not, we've got much better understanding of treating, got a much better understanding of tracing and testing, but what we now have is a difficult challenge of how people are managing under prolonged lockdown when we haven't had to face that in a generation. We've got people who are being deconditioned, particularly those very high-risk people who are shielding. And we've done a huge amount of work with our own shielders to support them mentally with the essentially returning as the noise dials back up, as they get back out into society. But also, how do you move from staying indoors for 4 months to getting back into a physically demanding job? We're starting to understand more that COVID-19 is taking a longer toll on a number of people. And we don't know what's going to come with flu. But we've got a number of people who have not been able to access COVID-unrelated healthcare for nearly 9 months. We are going to see a massive increase in heart attacks, strokes, and other illnesses not related to infectious disease. And then we've got the huge impact on mental health. We've got fear of the unknown. We've got isolation and loneliness. We had a number of people, as I said, who became vulnerable, who didn't believe themselves to be vulnerable before. Young people, people working on the front line, people working in house shares, people who are now caring. And there's a number of people I say that have 3 jobs in BT. They've got their BT employed job, they're a teacher teaching children who are now at home or were at home, and they're potentially caring for elderly or vulnerable relatives. It's really important we acknowledge that and have the conversation. And then my role is to help protect our customers and our colleagues and the business, making sure that we are working in a COVID secure way, making sure that we are implying evidence-based and government guidance, that we are able to turn things off when we turn it on. But underpinning all that is that we've got clear communication and leadership. And it's going to be a really challenging 6 to 12 months. We've got a number of other unknowns with new testing increases and vaccines, but being in it together is absolutely the way to approach this. And I'd like to hand back over for questions.
A lot of food for thought there, and quite a daunting picture, I have to say. Now, please do put questions into the chat. One question from me, if I may, to kick things off, and that is when this first appeared on your radar and on BT's radar back in March, it was new, it was unknown. We hadn't tackled anything quite like this before. What were the decision-making processes that you went through in the face of something quite so new?
Yeah, it's a great question. In the initial few weeks, we did find a very initial briefing we put out to colleagues that said there isn't a strong evidence that this is transmitting in the community. It seems to be transmitting to healthcare workers and people in hospitals. Clearly, that was not the case. I think when we understood very early, it was just after Christmas, I believe, when the Edinburgh team understood it was a coronavirus, we then were able to start reflecting back, well, what coronaviruses have we had in the past? How did we deal with MERS? How did we deal with SARS? That became the starting point of our planning. Coming from a company where SARS and MERS had a significant operational impact, I had a bit of a head run on that because we knew what was going to happen with containment. We knew lightly what was going to happen with the countries where it was first presenting. And we probably could guess how it was going to start showing up in the transmission rates. So what we relied on, we went back to what were the principles that worked then? What were the WHO responses? And what do they do in a pandemic? So we were working under that phase 2 for 2 or 3 months with our colleagues in Asia Pacific. But we're also able to learn from our colleagues in Asia Pacific what was working. So the stay-at-home order in Hong Kong, where we've got a large office, we could understand from colleagues in the field what that was doing to transmission rates and the massive increase in testing that they did. So for us, it was about keeping apart from people, keeping away from sick people, and that was very much the learning from Ebola. We thought at the early stages, you can probably only get this from sick people, and sick people will present as they have a cold. And MERS was very different in that way, that you were quite ill when you were infectious. So we worked very much on that principle, and then looking at it's probably not going to end up being like the Spanish flu. And I wish we'd never said that, because you could almost draw the curve right on top of it. But just keeping one eye on that and saying, well, we know that distancing and keeping people away from each other was critical. And I think that was some of the challenges in February and March, where that was perhaps less robust. And I would say that was less robust globally, not just in the UK.
Thank you. A bunch of questions appearing now in the chat. One that sort of leads on from that, from Veronica. You have given a very reassuring picture of your use of modelling and learning. However, what caught you by surprise, and how did you deal with it?
Oh, that's a great. I think it's a really good question. I think the challenge we had, one challenge we had was that people, that you couldn't get this just from symptomatic people, that the infectivity period was in a pre-symptomatic phase. I think from an organizational point of view, it was the strong impact of social distancing. And we've actually seen less sickness absence than we had thought. So I as you'll see from an earlier slide, we planned for 10, 25, 50 and 75% absence. I believed strongly we would see 25 to 50% absence. We saw much less absence than that. And that for me came as a massive surprise. And the adherence and the understanding of frontline staff, particularly in our field engineering, on how to work safely, and that working safely would protect them, has been remarkable. You know, how we really managed to capture the sort of understanding of the importance of communications, and that statement back, what does it mean for me? I think how that really landed with people, but definitely absence of a working population age. And as you'll know, as we can look back, it more than 50-60% of the cases were in the over 65s. So for us, I'd anticipated a huge, multiples, 20, 30 times more absence than we've seen. So that was the biggest shock for me.
And a question from Shraddha. Why global leaders aren't learning from each other on how various countries have dealt with it, and a few have been very successful in tackling COVID, like New Zealand, Australia, Vietnam, Hong Kong, China. If we learn lessons from one another, perhaps we may not need a third lockdown.
Yes, that's a very wise observation. I firmly believe we are at a point now where the global and European health organizations could start to look what works and how. The paper from the impact of Spanish flu as revisited in 2007, I believe we've got a real strong window, a real opportunity, a real window for some strong learning on what's been working. And even nationally, how have tiered restrictions really driven an impact? You know, I think today is very different as well, because in Ebola, CDC, ECDC, and WHO were all strongly aligned. That's been very different for a number of very different political reasons. And, you know, that's what we hope for the future, that we've now got all of those agencies starting to work together. I don't believe they were working against each other, but it was very difficult to see the commonality and we're all in this together as global leaders, as you say. And I think there was a number of political and other reasons that maybe drove that. So one hope that I have is that we maybe in the next 6 to 12 months pull together and respond as a global community.
And a question from Maxime. How do you see the impact on your corporate culture? And what are you doing to mitigate that? I
love this question, because this is a really interesting point in BT. Our purpose is we connect for good. Now, what we've done the last 6 months, you couldn't connect any better. We really have shown ourselves to be a true national treasure and the backbone of running, you know, a real challenging operation during unprecedented times. What we've actually seen is a strong improvement in our general culture, how leaders and colleagues work together, how they communicate, and how that we really ask people, are they okay, and care about it. Now, we were good in that place anyway, but it's really embedded it consistently, I think, down all levels of leadership, which is always a challenge when you've got 100,000 plus people in many different territories around the world. But I do recognise that there are different lived-in experiences between those on the front line. And I think what we've really managed to do with our communications and our leadership is to acknowledge, champion, and really talk about what we're doing and what's important. But the fatigue and our requirements to keep transforming that were pre-COVID have definitely been identified as areas of potential pressure. And it's really about helping build resilience to change, not resilience that we can get people to work harder, but how do we get people to support and manage and deal with change and not end up with our curve, the yellow and green scenarios. That's the biggest challenge me and the EXCO have I would see over the next 6 to 12 months. But what's great is we've identified it, we're talking about it, we're already building a program of support and a program of leadership expectations already. So we're, I think that's the biggest challenge both us and many other companies are going to face.
And looking forward a bit, a question from Jan. Are you thinking of maintaining some of your measures beyond COVID? Safe workplaces, face masks on public transport could be a good idea forever.
Do you know, it's a really interesting comment, because a number of the interventions that have been introduced is, have really been, sort of embedded by the government guidance. I think the key is, if we're going to introduce something, it's got to have a really clear stop or not, or appraisal of what's good. I think something we've really learned is the importance of safety management systems and hierarchy of controls. And you touch on a number of those. Safe working environments, I believe, are going to be a strong measure for the future. I also think the flexibility of work and how you manage homework, homeworking, work-life balance, I think there's some of the key things that we will continue to adopt. But I think the key principles for us in BT and me and my team is really applying rigorously and consistently the hierarchy of control, but following government guidance in the region and the country that we operate in. I learned that really strongly in times of Ebola, because every international nation dealt with Ebola very differently. So to try and cascade something down that works culturally in the UK and Europe may completely not work in Asia Pacific. And I think for me, it's about having that central approach. We follow government guidance, we follow those controls, and we adhere with them at all times, has really stood us in strong messaging and strong support. And I think that's why our people feel supported by the company and manage to deliver such a great job.
And a question from Eileen. Do you think that COVID vaccine will be mandatory for employees?
Is that employees in BT or employees in general?
I presume in BT.
I think it's difficult to say yes. I'm really sitting on the fence here. I think this would be very much driven by government. I think one thing we're very clear on, we would not be looking at doing vaccination before the vulnerable frontline healthcare workers, the vulnerable members of the community and frontline healthcare workers were vaccinated. I don't believe it will need to be a mandatory process. I think that will be led from a government standpoint. I don't believe it, as we were touching on COVID secure workplaces, we are not seeing evidence of workplace transmission in the operations we do. So I think we will definitely work with government. We'll hopefully have the opportunity to input into Public Health England's consultation on that. I think logistically it's a challenge. And I think the key will be what are the government communications and what's the priorities. And some of you may have watched the briefing with Jonathan Van Tam merely an hour ago. And I think that was one of the key areas he was looking at. But as we learned from 5G and public perceptions at the start, there is a huge amount of potential negative belief of vaccines. I think the government have to do a really strong and consistent and clear messaging on what they are and what they aren't, and really be strongly governed on social media misinformation. And I think misinformation is one of the highest risks that we are going to face as we enter into Easter and into summer. But in short, my position at the moment will be it's unlikely we would mandate it.
And you talked a fair bit in your talk about the importance of mental well-being. And a question from Olivia: how did you arrive at the roadmap for mental well-being?
Ah, yes. So this is it's an evidence-based model that we worked. My predecessor and my current team, we have always worked to this 5-pillar of well-being, and it's from the What Works Business and Community and What Works Centre for Wellbeing, and fundamentally, it's all of those elements of well-being in and out of work. I find a lot of wellbeing strategies focus very much on the individual at work or things. So they'll focus on dealing with mental health and very specific conditions. What we recognize is to have good mental health, you need to have good work, good relationships, and a feeling of support behind that. And also your mental and physical health are looked after and are impacted. So though there are 5 different pillars, if you like, they all work together and they are a seesaw. And what we learned from the pandemic is you can move between those pillars in terms of where you are in terms of a response. And that's a model we've worked on, and I have really worked very hard over the last 2 or 3 years to embed into our transformed organisation as we've taken on volume apprentice hire, as we've onshored contact centres, predominantly in areas of low economic deprivation, but also as the culture of talking about mental well-being has changed. So this model has given us a really consistent approach that we repeatedly use, clear messaging, consistently delivered and adapted to each of the different areas of the business as they need them. Financial well-being is financial security is a critical issue for our consumer colleagues. It's less so important than some of our more established head office areas.
Now we're heading towards the witching hour of 7 o'clock, but I'm going to grab 2 further questions out of the chat, if I may. I'm very sorry for anyone whose questions we haven't been able to get to, but one from Govind. As the pandemic unfolded, there was a high amount of data, a lot of which was unvalidated, flowing in. As a corporation, how did you manage the balance between deploying sustained procedures and guidelines versus reacting to real-time information, which can be disruptive and a cause for confusion?
No, great question. I think we worked on almost like a hierarchy of information. So we worked with WHO guidance as our first principle, particularly the first few months. They were the situation reports. ECDC, European Centre for Disease Control, gave some really excellent risk assessments. We looked to CDC because during Ebola and Zika, they were really leading the effort and found the information. And I wouldn't say it was misinformation or complex or invalidated. It didn't feel like it answered questions. It wasn't simple. It wasn't clear. But what was very evident is WHO, ECDC, and some of those more trusted research bodies such as Imperial College, and you start to map it. And I think the key was, how deep do we go down? And the fundamental question was, how do you stop transmission? Because I'm not in a position that I had to treat people. I didn't have to protect hospital supplies. It didn't matter to me so much. Once I realized that people over 65 were the ones who were likely going to hit hospital and end up in intensive care, I don't manage that in my business. It was, how do I stop transmission? How do we control transmission? And how do we not add to transmission? And it was that hierarchy of control. So it was centralized and national and global evidence, and it was rapidly reading. We've got 3 big piles of reports because we have kept them as we go. And, you know, what would the agents be that we would be looking at in terms of, it's a biological agent. How do you control biological agents? So it was stripping it back to the simple, and trying to keep on top of the news. I think one of the areas we did get kind of caught with that was antibody testing. I think we had this desperate hope that if we did mass antibody testing, we would see that 85% of the population would have it. And as we saw early trials that, and Public Health England were amazing at doing this, when it was 5% of the population, we really moved on, because it was about how do we stop the spread, how do we protect our people, updating the board, working with business continuity, and adapting the business for what might be coming, and scenario planning for what might be coming. So BT Sport's a very important part of our business. It became very obvious in March, it was unlikely that live sport would continue. So having those discussions with them, what other ways might we broadcast? How would you continue to deliver a service to subscribers? So, you know, you could read and read and read, but I think you started to get into a rhythm of who was producing regular, reliable statistics. And now that's augmented with the published evidence from the government. But you're right, between February and Easter, it was about digesting and balancing it and saying, does this impact on controlling the virus? Does this make our people safer? And what controls may be coming? And we've got to be very joined up to government and National Health Authority guidance.
And a final, very quick question from Mandy. What creativity, innovation, and opportunities that have been realised as a result of COVID are you most excited and/or proud of?
I think we with our people transformed a lot of our medical support services, and moving that into a more digital access wherever we are is really important. For a huge 80% of our population are working remotely in vans, in shops. But I think the thing that I'm really proud of as a team, it really brought welfare, the health, safety and well-being of our people front and centre, and leadership really catching the balance of that and the importance of that, and also the importance of consistent risk-based controls. You know, bringing them into the workplace, and often very simple. You know, it was moving people apart from each other. It was about managing the flow of people together. It was about controlling the activities that they were doing. And a lot of those principles were really, you know, framed in their welfare, you know, and welfare feels a very dated, you know, sort of very, very old term. But actually the new welfare, I think, is exactly what we're doing. And I think the way that we try and keep connected while we all work from home, it's slightly easier now, we've got video capability, but that's been something that I think as an organisation, we've been extremely agile and harnessed very quickly. When we look at some of our customers in our enterprise area, they're still taking a while on setting up this infrastructure and the ways of working. I think we moved to it at pace and successfully because we cared about the welfare piece underneath that.
Well, Richard, thank you very much indeed. And there was one question I didn't ask you because it sort of gave the answer in the question. And it was from David Cleveley, who said, fantastic lecture. Why is it that this can be so clear and the message from government so confused? Why aren't you in charge of our COVID response? I think that sort of says it all about how terrific your lecture and your handling of questions has been. I have to say, great questions and great answers. Thank you. Thank you, Richard, particularly for being with us. Thank you to everyone who's participated and asked questions, especially. Thank you to Carol Fletcher and Sarah Mackenzie at BT, and to Clelia McElroy and Kate Parsley from Pembroke on seamless organisation of the event. Just a reminder that there will be a write-up of the event being published shortly, including the video of the lecture, and the audience can continue to engage with the Corporate Partnership Programme through Twitter and LinkedIn. So a big thank you to everyone, and a special thank you to Richard, and have a great evening, everyone. Thank you very much.